My name is Edward Yoon. I'm the Chief of Interventional Radiology at Hospital for Special Surgery in New York. I'm curious about musculoskeletal health.
First of all, can you tell me about your work?
Yeah, so basivertebral nerve ablation, I would say it's been around in the US probably at this point about 6 to 8 years at this point, a little bit longer in Europe for it, including kind of the studies that they have done. Because clearly, when a new therapy comes on board, they have to do multiple clinical trials through the FDA before it's available to the public. So, basivertebral nerve ablation is essentially a minimally invasive spine procedure where essentially numbing or ablating the nerve that carries the pain signal from your vertebrae back to your brain.
Do you know how many people are affected by back pain in the US or in the world?
So in the US, it's estimated that about 30 million people are affected with chronic low back pain. And low back pain is actually the most common cause for why people go on disability. And then it's approximated by about 15% of those patients are affected by this specific entity called vertebrogenic back pain, which the deviant ablation or the basivertebral nerve ablation is aiming to treat. That's about 5 million.
Can you explain to me what basivertebral nerve ablation is?
So basivertebral nerve ablation is essentially ablating the basivertebral nerve, which resides in the vertebral body. And it's aimed at treating this specific condition called vertebrogenic low back pain. And we can often see that on the MRI, where there are these things called Modic changes. So if we see that on the MRI, and if the patients are having low back pain, it's designed to treat the back pain from that.
And what is ablation?
So an ablation is our way of saying that we're going to burn the nerve, but it's more of a technical term so that, it's a little bit easier for the patients to stomach instead of me saying, hey, we're going to burn your nerves versus we're going to ablate your nerves. So there are many different ways that we can ablate a nerve. One is with heat and another one is with microwave or with ice. But in this specific instance, we are essentially taking away the nerve with heat.
Can basivertebral nerve ablation solve back pain?
A very specific subset of back pain that is called vertebrogenic back pain. When people are having low back pain there are these things called endplates, where typically our spine is composed of bone, disc, bone, disc, bone, disc, and we're stacked on top of one another. And as the disc starts to degenerate, sometimes it can actually erode into the endplate, which is the bone right next to the disc. And that can cause inflammatory changes. And that will be the source of why someone's having pain.
So, how can someone know whether this procedure will help them?
It's great that we have this biomarker on imaging or the MRI, because most people who are going to have back pain or back issues are going to end up getting an MRI if they've tried kind of the physical therapy for six weeks and whatnot. And if they don't get better, they'll get an MRI. And there are these specific findings on the MRI called Modic changes. And these are the inflammatory things that I was talking about before, where there are endplate defects leading to inflammatory changes that we can pick up on the MRI. And so if we see that, and you also have back pain that is worse with sitting or bending forward or carrying a backpack, you're a very good candidate for this specific ablation.
What is the type of back pain that basivertebral nerve ablation does not help with?
There are many different reasons for why someone can be suffering from back pain, right? It could be muscular. It could be from a disc herniation. It could be from a fracture. It could be from facet arthritis, which are tiny little joints in the back. So if it's any of those other causes of low back pain, the BVN ablation will not help with those conditions.
Do you find that there are a lot of patients that are asking you about this? Are they aware of this treatment?
At this point, I think the therapy has gotten some decent traction in the media and especially amongst the referring providers where they are aware of this therapy. So I get a lot of patients that are specifically asking for this. But I think in the general population overall, It's not like, spine surgery or an epidural injection. It's not as well known as those therapies yet.
But this is something that is more permanent, right? I mean, the epidural is kind of like a maybe just a temporary fix.
Correct. So there are different types of nerve ablations that we perform, but this specific nerve does not seem to grow back because it's not covered by this thing called myelin. So it doesn't seem myelinated. So the nerve doesn't grow back. And again, this is a fairly new therapy. So when looking at some of the patients in Europe or in America that have had it for about 8 to 10 years, if you do get pain relief, it does seem to last for a very long time, if not lifetime.
What is the basivertebral base? What is I'm having a problem.
Yeah, it's very difficult, but it's
I
kind of
keep
counterintuitive. Yeah. So if you want to
it's
shorten it, you could call it BVN ablation or basivertebral. If
no,
you're from the UK, they will be like basivertebral, but in America we say it basivertebral.
vertebral. Okay.
Yeah, like
Okay.
like vertebrae. Think of like
Yeah.
vertebrae. It will go vertebral rather than vertebral.
Okay. Okay.
Think about vertebrae when you.
Basivertebral.
Yes, exactly.
Okay. What does the basivertebral nerve ablation procedure entail?
So it's an image-guided, minimally invasive procedure where the procedure is done through these needles. So you're not getting a big cut or a suture or anything like that. So it's done under moderate sedation, just like when most people go for colonoscopy and you get kind of put in that twilight zone. And these needles are put in under fluoroscopic guidance, which is a very low dose X-ray. And the needles are placed under that guidance, one at each level. And then the nerve ablation is performed where the nerve is heated up to about 75 or 85 degrees, anywhere between 7 to 15 minutes.
That seems pretty straightforward. And so, is it general anesthesia?
It can be. So typically that decision is up to the anesthesiologist, but majority of the patients are actually not going under general anesthesia where you're getting the endotracheal tube down the throat. It's kind of moderate sedation where they kind of put you to sleep, but you don't need like a tube to breathe for you.
Like a colonoscopy or something? Is that?
Exactly like a colonoscopy. Now, there are certain situations where patients have a lot of comorbidities or they feel that the anesthesiologist feels that they're not able to protect the airway and during the sedation, then they do general anesthesia. But majority of the cases are done through moderate sedation.
What are the possible complications from a basivertebral nerve ablation?
Anytime we're working around the spine, there's obviously always a risk of injury to the nerves or the neural elements. But again, this is an image-guided procedure, so we're looking at the needle as it advances under X-ray the whole time to keep things safe. And then secondly, potentially there could be an infection.
Who's a good candidate for the basivertebral nerve ablation?
So it would be anybody suffering from low back pain from the specific entity called vertebrogenic back pain. And typically these things are picked up by MRI called Modic changes, type 1 or type 2, where there are kind of inflammatory changes that are seen on the MRI.
What is a reason why someone would begin to have this type of back pain? Are there, specific injuries, or is there something specific that often causes this type of back pain?
There are a bunch of different theories on how this comes about, but I think predominantly what's happening is as your disc starts to degenerate as we age, it can start to encroach into the endplate, which is the bone right next to the disc. And that causes all sorts of inflammatory particles to be released into the vertebral body, and that can cause pain.
At what point when you have back pain should you consider talking to a specialist?
I would say it just depends on the severity because, whether it be disc herniations or not, majority of back pain or underlying conditions actually resolve conservatively over time, which is a great thing because our body is able to heal itself. But obviously, if it's typically abrupt, and it's quite severe, meaning that, you're not able to function on a day-to-day basis, then you should definitely go see a doctor. Also, another finding would be starting to have lower extremity weakness. or upper extremity weakness, because if the nerves in the low back in your spine get pinched to a point or have acute sciatica, that can lead to weakness, and that should be followed up by a medical professional for sure.
Do they need to be of a certain age to have the basivertebral nerve ablation?
The clinical trials excluded anyone under 18. I personally have treated someone that was 16, but this is typically like a young to middle-aged disease where majority of the patients are coming in their, 30s, 40s, and 50s kind of a thing.
Are you doing research currently?
Yes, I'm just starting to enroll patients to actually collect some real world outcome data. There have been 2 or 3 like randomized control trials that have been done so far, but we're going to run a multi-center, large, almost like a registry data set where we're looking at all the patients where this procedure is being performed on and seeing why sometimes it works, right? Because there's about 25 to 30% non-responder rate, meaning that it doesn't work for them. And we want to try to figure out why those subsets are not being helped by this specific therapy. Are there any other kind of confounding variables? So I'm kind of getting in research for that.
What made you want to study, to go into radiology and maybe specifically into spinal issues?
I was actually really interested in orthopedic surgery when I was in medical school, but I rotated with interventional radiologists my 4th year of med school, and they were doing all these kind of minimally invasive therapies under image guidance. And I thought that was amazing that we're able to treat people using, these needles and catheters without having to cut them open. And so I got into radiology specifically to do interventional radiology. And during my fellowship here at Hospital for Special Surgery, my interest in spine and musculoskeletal interventions kind of grew. So I did a second fellowship just doing interventional spine and just musculoskeletal interventions. And then I came back after that.
When you think of a radiologist, you don't necessarily think of someone who does have that interventional aspect to your profession. And so it's so fascinating. It's like in radiology, there are so many different specialties, right, that someone can go into. And you chose a really interesting one.
Obviously, imaging is the foundation of our training, but there's a whole interventional and clinical kind of aspect to the specialty, which is why actually interventional radiology has almost become, or it has become, a separate residency and specialty, because before a lot of the procedures were being done, but now there are so many new therapies coming out. We need to almost create a new fellowship just to learn how to evaluate patients and to do all these new procedures that are coming out. Like if you're trying to do both, it's quite difficult at this point.
That's very good to know. So thank you so much, Dr. Yoon.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.